Not many people know that pancreatic cancer is one of the most dangerous types of cancer out there. It even causes more deaths than breast and prostate cancer in many countries. What's even more alarming is that this disease often goes unnoticed and, despite rising numbers, gets very little public attention. Imagine this. If you knew just a few key symptoms, you could potentially help yourself or someone you love in time before it's too late. Pancreatic cancer is called the silent killer for a reason. With a survival rate of only about 10% after 5 years, it often goes undetected for a long time, claiming over 65,000 lives in the USA alone each year. It's shocking that about 80% of people with the disease overlook early warning signs or dismiss them as harmless complaints until the cancer is already advanced and has spread. But studies show that many of these symptoms appear 3 to 6 months before diagnosis. This offers a rare window of opportunity for early detection. The pancreas itself is small and hidden deep inside the belly, but it has a vital job. It controls blood sugar levels and makes enzymes that are essential for digestion. Because it's so hidden, tumors can grow there without causing symptoms right away. That's why it's even more important to recognize even subtle warning signs. In this video, you'll learn 8 surprising signs of pancreatic cancer that are often missed. Studies show that having just 3 of these signs at the same time could increase the chances of early detection by up to 70%. Why is so little known about such a deadly disease? Why isn't this knowledge already a basic part of our healthcare? If you think this topic is important, like this video and subscribe to our channel so you don't miss any vital health tips. Now, let's move on to the first sign. Let's get to the first sign now. Pancreatic cancer can really mess with your digestive system in a few different ways. Your pancreas is super important for breaking down fats, proteins, and carbs into tiny pieces that your body can use. It helps your body get all the good stuff from food. If a tumor grows in or near your pancreas, it can stop the pancreas from making enough enzymes or block the tubes where the enzymes come out. This starts a whole chain of digestion problems, which might seem small at first, but they're actually a big deal. Because your food isn't broken down right, it stays in your stomach longer. This can make you feel sick, throw up, get bloated, and just feel full all the time. Over time, you might lose your appetite, which often leads to losing weight without trying, losing muscle, and not getting enough nutrients. One really clear warning sign is a change in your poop. It might look pale, greasy, and smell really bad because your body isn't breaking down fats anymore. This isn't just a simple tummy ache, but a sign that something more serious is going on. Knowing these changes can be warning signs can actually save your life if it's something serious. Even if these symptoms don't seem like much at first, understanding how they're connected to your pancreas gives you a great chance for an early diagnosis and better treatment options. Pancreatic cancer can really drain your body's strength, way beyond just feeling tired from a normal day. This exhaustion doesn't feel like being tired after a long day at work or not getting enough sleep. It's a deep, lasting feeling of having no energy that stays even after a lot of rest. You wake up as if you barely slept. This is because cancer cells take away energy and nutrients from the body, slowly wasting it away. Even everyday tasks like walking, climbing stairs, or light chores around the house can suddenly feel too much to handle. Life becomes a constant struggle. On top of that, there are often emotional struggles like sadness, anxiety, or feeling easily annoyed. Many people affected don't sleep well, which makes the exhaustion even worse and creates a cycle of physical and mental exhaustion. What's dangerous is how easily this tiredness is mistaken for stress, getting older, or overworking. Unlike normal tiredness, it doesn't get better with rest, but actually gets worse over time. If you notice this kind of constant, deep exhaustion, you should get medical advice early on, because it can be one of the few early signs of pancreatic cancer. Early signs of pancreatic cancer. Fever. When you have pancreatic cancer, often means your body is reacting to swelling or irritation, which is caused by the illness. If your pancreas gets inflamed, your immune system kicks in and starts fighting back. These changes in temperature can be confusing because they come on suddenly and then go away. Sometimes you might shiver a lot and feel really cold, and then your fever quickly shoots up. This is very different from the steady fever you get with a normal infection. Especially if you also have jaundice, it can lead to a storm of fever, inflammation, and feeling really tired. Your body is then fighting on many fronts, against a blocked bile duct, against inflammation, and against the tumor itself. This kind of fever often comes with night sweats, chills, and just feeling unwell in general. Unlike viral infections, which usually go away after a few days, these fever episodes keep coming back or stick around for a long time. These repeated temperature changes should definitely be checked out by a doctor. One of the often missed side effects of pancreatic cancer is how it affects blood clotting. Not many people know that this type of cancer can make the blood thicker and lead to dangerous clots. This is called hypercoagulability, which means the blood clots more easily, especially in the deep veins of the legs. This can lead to a deep vein thrombosis, DVT, which shows up as swelling, warmth, tenderness, and a bluish-red color in the leg. These symptoms might seem harmless at first, but they hide a big danger. If a piece of the clot breaks off and travels to the lungs, it can cause a pulmonary embolism there, a life-threatening emergency. Why this happens? The tumor releases inflammatory substances that mess with the balance of blood clotting and greatly increase the risk of clots. The warning signs of a pulmonary embolism are clear: sudden shortness of breath, sharp chest pain when breathing in, and a fast or uneven pulse. If you have these symptoms, getting emergency help right away is super important. Knowing about this connection can save lives, because unexplained swelling or trouble breathing should never be taken lightly. When pancreatic cancer starts to grow, it can also affect nearby organs, especially the gallbladder and the liver. This happens because tumors often block the bile duct, which is the important tube that carries bile from the liver to the small intestine. When this pathway is blocked, bile starts to build up. The gallbladder, which is usually about the size of a small pear, then swells up because it keeps storing bile, but can't empty it anymore. The liver can also swell if bile builds up inside it. This swelling can sometimes be felt during a physical exam and feels like a firm bump under the right side of the rib cage. Modern imaging tests like CT scans or ultrasounds can clearly show these changes. Since the gallbladder, liver, and pancreas work closely together, a problem in one of these organs often affects the others. That's why doctors specifically look for these things during routine checkups, because these changes can be a very important sign of a tumor in the pancreas. Pancreatic cancer can also really mess with how your digestion feels, in a way that's easy to miss. Your pancreas makes special juices called enzymes that break down fats, proteins, and carbs so your body can easily soak up all the good stuff from food. When a tumor messes up this delicate process, you might feel a constant sense of fullness, bloating, and tightness in your stomach. One of the earliest signs is feeling full after just a few bites. This is called early satiety. This happens because the tumor pushes on nearby parts like your stomach or intestines, making less space and slowing down your normal digestion. Meals that used to be normal suddenly lead to a bloated belly, pressure, or a little bit of nausea. Unlike harmless discomfort from eating too much, this bloating is stubborn and doesn't go away. It doesn't get better with common over-the-counter medicines or simple changes to your diet. Your belly can look really puffy, even if you haven't eaten anything at all, and that feeling often lasts all day long. Because these symptoms are easily confused with stress or changes that come with getting older, they often aren't taken seriously, and people don't get medical help until it's too late. If bloating, pressure, or feeling full quickly stick around for weeks, you should definitely get them checked out by a doctor. Spotting these stubborn digestion problems can open up a valuable window of time for an early diagnosis, for a disease that's often found too late. The type and location of pain can give important clues about a tumor in pancreatic cancer. If the cancer develops in the body or tail of the pancreas, many affected people complain about a dull, constant pain that seems to come from deep within the upper abdomen. Often this discomfort spreads like a belt to the back and gets worse after eating or lying down. The pancreas is located in the middle of a dense network of nerves and organs. When the tumor grows, it presses on these structures and triggers pain signals. Some describe it as a nagging pain, others as a constant, strong pressure. It's typical for the symptoms to come and go at first, and then become more frequent and intense later. The exact pattern of pain gives doctors important clues to distinguish pancreatic cancer from other causes. That's why persistent abdominal or back pain that cannot be explained should always be medically investigated. The color of your pee can also be an early warning sign. When pancreatic cancer blocks the bile duct, a condition called jaundice often happens. This is when bilirubin builds up. It's a yellow substance that's made when red blood cells break down. Normally, your liver processes bilirubin, and it leaves your body through your poop, which gives it its brown color. If the flow gets blocked, the bilirubin level in your blood goes up, and your body tries to get rid of the extra through your pee. This makes your pee turn dark yellow to brown, kind of like cola or strong black tea, even if you're drinking enough water. Many people mistakenly think it's because they're not drinking enough or because of what they ate. But if your pee stays dark for several days, you should see a doctor right away. Often, this color change appears even before your skin or eyes turn yellow. Knowing this connection can help you spot jaundice, and therefore pancreatic cancer, sooner. Pancreatic cancer often moves quietly, but its effects are anything but silent. What makes it so dangerous isn't just the illness itself, but how easily its early signs can be missed or brushed off as everyday aches and pains. But as we've seen, these signs are not minor things, but quiet alarm bells from your body. If you recognize just a few of them, for example, dark urine, unexplained tiredness, constant bloating, or back pain, you could give yourself or a loved one a crucial head start. Time to get help, time to take action, before it's too late. Because knowledge can save lives, and sharing that knowledge can save even more lives. If this video has helped you understand the hidden warning signs of pancreatic cancer, imagine how many others could benefit from it. Please subscribe to the channel and turn on notifications and help us spread vital health information. Thanks for watching, and remember, your awareness and knowledge today could mean survival tomorrow.